Are you someone who has been experiencing the muscle cramps for quite some time but not able to fix it for the long term? Then you are at the right place. In this live stream, I will be talking about what exactly the muscle cramps are and how you need to get yourself examined and treat it for the long term. Let me know in the comment section whether you're watching this live or watching this on the replay. My name is Ishan Arora. I'm a physical therapist and I have been helping people with aches and pains and injuries for more than 13 years now. So let me take you through what exactly the muscle cramps are and what exactly you need to do about it. Now, the muscle cramps are sudden painful contraction in the muscle that happens involuntarily because of number of reasons that is happening in the muscle. Sometimes there is a muscle imbalance, or sometimes there is an overuse or electrolyte imbalance that is happening in the body, which is leading up to the muscle cramp. But there are a number of other reasons for the muscle cramps. So let me take you through one by one so that you can better understand and start treating it effectively. One of the most common reason for the muscle cramps to happen is a dehydration and electrolyte imbalance. So when you engaging in activity which is too strenuous or too heavy in intensity, that can lead up to the dehydration, as you know, and that can also lead to the electrolyte imbalance when you're losing salt out of your body in the form of sweating. So if you're not replenishing the salt, there are good chances that you can start to have the cramping sensation in the body. So because of the dehydration and because of electrolyte imbalance, there are chances that the body can go into muscle cramping very easily. Now, the second reason for having the muscle cramp, which is often neglected, is overstraining the muscle or overusing the muscle. So, whenever you're using the muscle quite a lot, there are good chances that the muscle will have a lot of stress building up slowly and gradually. And since you're not taking care of that load, eventually the muscle can go to the break point where the muscles can go into the cramp. And this is often the most neglected part. This is one of the most common reasons for having the muscle cramps. The muscle cramps usually happens to muscle either they are too tight or over exerted or like very overtrained. Okay, and it can also happen to the muscle which is weak. So when you're using the weak muscle, that can also go into the cramp. But this is again I have seen is one of the most common reason which is often neglected, and because we don't pay attention to this sign, then there are good chances that the cramps keep coming back for you. So very important to look for this thing, especially when you're getting the cramps. Okay, so the third reason is the poor circulation of the muscle. So when you have the poor circulation to the muscles, there are good chances that muscle can go into cramping. And this is also one of the most common sign and symptom, and you can see the cause for the muscle cramps to happen. The other cause for the muscle cramp to happen is the nerve compression. So when you have the nerve compression, which also act like a fuel to the muscle will not be able to perform optimally and leading up to the cramp. This is again one of the most common reason for people to get the cramp. So if they have any sort of nerve compression in certain area of the body, such as the calf muscle, the hamstring muscle, or the hand muscle, that muscle can go into the cramp as well. Okay, so cramping can happen because of number of reasons, as I said, like because of electrolyte imbalance, because of poor circulation, dehydration, nerve compression. But the most common reason I have seen are two, which are basically the dehydration and electrolyte imbalance, along with the muscle tightness. Now, there are certain medical conditions which also causes the muscle cramp to come. So there are certain conditions like a thyroid condition, or like if you have a diabetes, that can also lead up to the muscle cramp. This condition can sometimes react in a way that it can lead to the muscle. So in order to treat it effectively, it's important for you to know what exactly the root cause of your muscle cramps. Okay, and once you know that, it becomes so much easier to treat the condition. Now, let's get to the diagnosis. One of the best ways to get diagnosed for the muscle cramping. The first and the foremost way of getting the muscle cramping diagnosed is if you can get yourself examined by a physical therapist or a doctor who will let you know what exactly the root cause of the problem in case of the muscle cramp. So for example, if you are someone who's very tight in the muscle like hamstring, calf muscle, the back muscles, these are the muscles usually get cramped, especially at night. Okay, and whenever you're trying to stretch the muscle while sleeping or in a position like if you're working and you suddenly try to stretch those muscles, they can go into the cramping very easily because they were tight, they were overused. Okay, so it's important to understand the root cause of it, and the physical therapist and your doctor would tell you what exactly the reason of your muscle cramp and how to treat it effectively. So is it because the joint, underlying joint, is stiff and tight, which is leading up to the tightness of the muscle, or is the muscle is too tight, overused, or is the muscle weak? They will be telling you, and through which you will be able to treat it effectively. And one of the reason, if you are treating muscle cramps and why is it not feeling better, is because you're not treating the root cause, you're not addressing the cause, but you're trying to just fix the symptom. Someone must have told you, okay, now the muscle cramp happens because of electrolyte imbalance, so you probably take electrolyte, but you're not addressing the other cause. Again, the other cause which have seen happening very commonly is overuse or the tightness of the muscles. If you're not addressing the tightness of the muscles or the lack of mobility of the joint, that will also result in the muscle cramp. So it's important to address the root cause if you want to treat it effectively. Okay, now the other way to get yourself diagnosed is like getting the blood test done. So you can get the blood test done to rule out if you have any issues with the kidney function test or electrolyte imbalance or any issue that is there which is leading up to the muscle cramp. You get to know with the test as well. Okay, so very important to know what exactly the reason for the muscle cramp happening in your case. Now you can get the nerve conduction test done in case you're if you're experiencing some form of nerve compression signs, and like you have any tingling, numbness which has been there for quite many days or some days which has been bothering you, but you're not getting yourself examined, that can also lead up to the muscle cramp as well, because you're not addressing and you're not listening to your body, you're not watching the signs, and that is why it's happening. So very, very important. Again, now we are going to talk about the treatment part of muscle cramp, but again, as you can see, it becomes so much clear and easy if you know the root cause of the muscle cramp, and you can treat it effectively, because slowly and gradually, once you start working on the things which are causing it, you'll be able to fix it for the long term. And most of the people don't fix it for the long term, they just find a quick fix and they just go along with it, and that doesn't really have help you on a long run. If you want to get rid of the muscle cramp pain on a long run, you need to address the root cause. Very important. Now let me take you through what are the treatment part that you can start working on right away. Now, the treatment usually involves treating the root cause. Again, if you're not treating the root cause, it's of no use. If you're doing something which is acting as a quick fix, you're not addressing the pain or the cramps for the long run. And eventually, you will not be able to cure it on a long run. It'll keep coming back for you. And the more it keeps coming back for you, it can be more in intensity. So be mindful of that. Okay. So again, as I said, the one of the most common reason for the muscle cramp to happen is a dehydration. So make sure that you hydrate yourself, you take enough fluid, or you take enough electrolyte when you're doing activities like a heavy intense sport or intense exercise in the gym. If you're not taking the electrolyte, again, that can lead up to the cramp. The second treatment part to address the cramping is stretching the muscle regularly. So if you're stretching the muscle which has been tight and stiff, and you know these muscles, these are joints which are really heavy for you on a regular basis, start addressing the mobility of those areas, start stretching those muscles, because once you start doing that, you will be taking care of the issues which are leading up to the cramp, and effectively the cramps frequency and both the intensity will come down slowly and gradually. So it's not a one day thing. When the cramp comes, right, the cramping sensation may last for few hours or maybe for few days as well. Okay, see what are the muscles which are tight for you, stiff for you on a regular basis. Start stretching those muscles, and what I've seen, this is the most single effective way of getting rid of the cramps faster. If you start stretching and start mobilizing the tighter areas, once you start doing that, make sure that you start stretching the muscles for the long time. So like your holding time of the stretches needs to be longer. For example, if you stretch your calf muscle, your hamstring muscle, you need to stretch it each time for 1 minute. So effectively you hold the stretch for 1 minute and you repeat it like 5 6 times. Like if you're getting the cramps in the calf, stretch your muscle in 1 minute calf stretch and repeat it like 5 to 7 times. Now, When you are in the acute phase of the cramp, definitely you may not be able to stretch your muscle, so you don't try to stretch the muscle immediately. The best effective solution is wherever you get the cramp, just grab that area, compress that area, so that it act as a like a massage for that area, and also it helps in stretching that muscle passively when you grab that area. So grab that area, pamper that area a little bit. Once you feel like it has opened up a little bit and you feel like okay, now you can stretch your leg muscle, or you can stretch your calf muscle or the hamstring muscle wherever you're getting the cramp, you have to slowly and gradually prepare the area for the stretching. Okay, though I told you the stretching helps you the most in getting rid of the cramp, but you may not be able to do it when you are in acute pain. So make sure that you pamper the muscle, pamper the area, and once you feel slightly comfortable, then try to stretch that muscle which is into cramp, and try to hold the stretch slowly for few seconds, then gradually increase it to like a longer time, like a 30 seconds to 1 minute, and that will help you address the cramps faster. So the other treatment part that involves treating the cramp is doing the hot and cold therapy. So when you're doing the hot therapy, what effectively you're doing is you're trying to decrease the tension in the muscle which is going into the cramp, especially when you're doing the heat compression. And when you're doing the cold compression, if the reason for your cramp is the inflammation around somewhere, so again the cold therapy will help in reducing the inflammation around that area. And secondly, what does cold therapy does is it helps in decreasing the nerve supply to the muscle. So sometimes your nerve firing could be quite a lot to the muscle, which could also leading up to the muscle cramp. So when you apply the cold pack, that basically desensitize that area and reduce the nerve firing as well, and helps in reducing the cramping sensation. So no, you can also get the massage done to help that area, to help release the tension which is building up to the muscle. So if the muscle which is going into cramp, you can get the gentle massage done. If you're especially in the acute phase where you can't do much, you ask someone to help you gently massage that area. And once you get the massage done on that area, slowly and gradually the muscle will start opening up. And once the muscle opens up, then you are in a position to slowly and gradually take it to the point where you can stretch the muscle further to gain the length and eventually get rid of the muscle cramp as well. Okay, now there are certain medications which also leads up to the cramp, so you can discuss with the doctor what all medications you're taking, because that can also be the reason for your cramps. And again, as I said, certain medical conditions like a diabetes and thyroid disorders can cause the muscle cramps. So again, if you are treating that condition, you can expect those muscle cramps to be there. But if you're taking the medication, you can start taking care of that condition in a better form, so that that can help you reduce the cramps as well. Okay, so if you start addressing the medical condition which are leading up to the muscle cramp properly, so again that will also help you reduce the cramps as well. I hope you found this live stream helpful, and if you have any questions that you feel I haven't answered regarding the muscle cramps, you let me know in the comment box below. And also, if you have any questions in general, put that in the comment box below, because I will be answering those questions live for you in my next live stream. So make